Hey everybody, it's Dr. Eric Balcavage. We're back for another edition of Thyroid Thursday, and this is another Q&A. And back with me is Tara Quintana. She is a functional nurse practitioner. This is episode, I don't know what actual number this will be, but this is our third or fourth, I think, episode. This may actually be the third one, right? The fourth one, Tara's going to give me a hard time because I stood her up. For one of the episodes. So this is 3. It was supposed to be number 4 of our Q&As together, but I stood her up just because I think I'm getting old as well. And my brain is, some days it just doesn't work as well. So maybe that says something about my own health and well-being. I don't know. But Tara, welcome back to the Thyroid Answers podcast. How's everything going on in your world?
Things are wonderful, Eric. I'm very happy to be here. Life is great. Hectic, but great.
Awesome. And so I've released maybe one episode, I think, so far of the Q&A. And that has, on my end, that has created some more questions. How's it gone on your end? Have you heard anything good, bad, indifferent, people confused, or are you hearing that we're providing some positive things from your gang? Because most of the questions that we're going through are ones that came from your listeners, your followers.
I've heard really great feedback and actually received a ton more questions. And the feedback I've gotten is that they love this. They love this structure, this format and that they're getting their need to know questions answered.
Awesome. Well, we got a lot to do because we get through maybe 5, 6, 7 of these questions, maybe somewhere around there. I think that seems to be the average in the hour or so that we're meeting together. Yeah. So we might as well get right into it. So let's get into it. What's the next question you got in line?
Perfect. This is the great one. Is there a connection between oral health or hidden dental infections and chronic symptoms potentially related to the thyroid?
Yeah, I believe so. I think that's been justified by the scientific literature. And, somebody might say, well, might ask the question like, is it specific to the thyroid? And I don't know that it's specific to the thyroid. I think it's specific to if you have an infection, if you're leaking oral bacteria or oral bacterial toxins into the body proper, that's going to trigger that cell stress, immune response, inflammatory response that's going to then result in reduced conversion of T4 to T3 and potentially drive thyroiditis. So yeah, there's literature to show this. And I've seen it myself in multiple clients, and we've run Cyrex Labs Array 12, where they look at it's their multiple organism panel. So when somebody has an immune issue going on, we can look at some of the Cyrex's tests. There's other companies as well, but Cyrex runs a panel that looks at the most common organisms that are associated with triggering immune activation or autoimmunity, however somebody wants to say it. And oral bacteria is on there. And I've had, I could probably say of ones that I can think of right at the top of my mind, probably at least 6 people I'm currently taking care of, they had oral-based immune responses. And most of them didn't know that they had an oral biome problem or that they're oral bacteria. So we'd get that test back positive. It shows that they're showing antibodies to an oral bacteria. And they're like, I don't have any issues. I don't have any pain. I don't have any. Okay. And I know one patient, she went to her primary care physician or her primary dentist, and the dentist said, there's nothing wrong. But then she went to another dentist and got a cone beam X-ray, and three or four of her teeth had pretty significant infections in them, but they just weren't as detectable by, just poking around, and they were all old root canals and things. So, it's helpful. So my answer would be yes. What do you think?
I absolutely agree. And I think what you said needs to be underscored, that I don't believe it's just related to the thyroid either. The thyroid obviously plays a major role with the body, but I think it's more of an immune issue. Like you said with the Cyrex labs, I also run that a lot, and I've seen that one time so far with an individual, and it can be a game changer to really uncover that kind of information. And when it comes to oral issues, the literature, as you said, is definitely pointing to a huge connection between multiple systems in the body, the cardiovascular system being one that, to me, is front and center, right? The
Mhm.
connection between bacteria in the mouth and what it can do with the heart. So yeah, I feel like having the right practitioner with whatever we're doing. So a primary care practitioner that's open and willing to listen, a dentist that's open and willing to listen, or going and finding an alternative person to run those tests, like that particular scan, can be vitally important. Absolutely.
Yeah, and I think it's important to understand that you don't have to have oral pain, right? You could have receding gums, and that's allowing bacteria or bacterial toxins to get into the system. You can have an injured tooth or a damaged tooth or a root canal or something that's creating a space for bacteria to overgrow and create problems. And these are bacteria that many times that live in the oral cavity. They're supposed to be there. They're not supposed to be in the bloodstream or in the body proper, and that's where issues can occur. Good.
Yeah, and I don't think enough people think about the oral microbiome. Like, I think most people understand about the microbiome in our digestive system, but we have microbiome everywhere, right? In our
Yeah.
respiratory tract, on our skin, and definitely inside of our mouth. And so many of the products that people are using, I know I switched everything. I think we talked about this on one of the other episodes, that about changing out detergents and things like that, but also things like toothpaste. And one of the things I do in my practice is, when all of the information that my patients fill out, I go through everything. There's very detailed questions related to oral health. And then I tell people I don't have an antenna or antennae. If I did, they would go up, right? When I
Yeah.
see things like 5 root canals or multiple crowns, mercury in their mouth, just different things that could have potential impacts on our overall health.
Yeah. And it's tough too, because a lot of times what people might be doing to have better oral health care is actually part of the problem, at least from my perspective. I don't think that we need to be doing all these antimicrobial washes, rinses on a constant basis, because when we're using like mouthwash on a consistent basis, that seems like it can potentially negatively impact not just potentially problematic bacteria, but also have an impact on the commensal bacteria, the oral cavity. And I've talked at length about this to some in the dental industry, and they're like, no, it is a real thing. We shouldn't probably be doing that. But yet that's what we grew up with. Everybody grew up with their green bottle of liquid, and kind of worked on those things. And sometimes even the things that we do orally, like picks and flossing, can create disruptions of the mucous membrane or the mucus layer or the soft tissue that then allows a an area for organisms or their toxins to get into the body proper. So it can be an issue. But all right, let's jump to another one. See what else we can find.
Okay, I have Hashimoto's disease and then had my thyroid removed, and I'm on combination T4, T3, but I still don't feel great. What am I missing?
Well, step one is, I would definitely question, well, like, why did you have your thyroid gland removed? But let's move on to the next piece is people think that, and we kind of hinted to this originally, which is that if they have Hashimoto's, they have a thyroid gland issue. The person has an immune system issue that was damaging their thyroid gland and probably other tissues. So removing the gland doesn't change the fact that you have an immune issue going on. So we might think that, oh, the issue is my gland. The issue is my gland. And I get that all the time when people call for help. Like, what can you do to fix my gland? I have Hashimoto's. Like, what we can do to fix your gland is not overprescribe you with thyroid medication or try to optimize your blood levels with T4, T3. What we need to do is figure out why your immune system is behaving the way it is. Is there something that's still driving a cell stress response, or do we just have a dysregulated immune system and it needs to help be encouraged to be reset? So for the person who has Hashimoto's, has their thyroid gland removed and is on T4 and T3 medication and still doesn't feel well, it's because you haven't addressed the real issue, which is there's something driving an imbalance in the immune system. And that's what you need to uncover. And I sound mean when I say, like, trying to optimize T4 and T3 with medication is not the right strategy. That's not to mean that you can't feel better with some T4 or T3, but it doesn't fix the problem, right? It's like playing, at the Jersey Shore, we have whack-a-mole, where there's a little game where the thing pops up and you hit it and you think you got it, but then it pops up somewhere else. Just trying to manipulate the blood level of thyroid hormone doesn't restore thyroid physiology. It just puts more hormone into a system. And the concern is, and I keep saying this over and over, is that not only might you have some temporary improvement of signs and symptoms, but the thyroid hormone that we're giving people may actually contribute to the underlying deterioration of their health if we're not if we're just blasting away. Some people need some thyroid hormone. It's true. Some people need some T4 to replace what their thyroid gland should have made. Some people like this who has their thyroid gland removed might need some T3 to replace what the thyroid gland would make. But that's only 5 to 10 micrograms of T3. That's about average of what a thyroid gland would typically make. So why would we be thinking that they might need 20 or 30 or 40 or 50 or 60 or more micrograms of T3? Like, that's better. Most of the T3 isn't made by their thyroid gland. It's converted from T4. So she's probably going to need some T4. She's probably going to need some T3 to replace what a healthy thyroid gland might make. However, we also have to consideration, and I have a client right now I'm working with who the initial person was trying to manipulate the blood levels. And then we had a discussion like, that's probably not the right strategy. We need to be closer to what a thyroid gland would have made had she had one. And she's going to need some T4 and T3. But then we had to take it one more step. This is a person with chronic illness. Somebody with chronic illness, if they had a functional thyroid gland, would still not make the same amount of T4 and T3 from their thyroid gland that a healthy person is. So we can't always assume that the person that we're going to give the thyroid hormone replacement and think that it's going to work as if the person's healthy, because they're not. And so the conversation I had with my client and their physician was, we want to get them as close to what a thyroid gland would have made in her situation. So we start with what a thyroid gland would normally make if she had one, and then back down from that because the person's chronically ill. And because typically, this as well, when somebody has chronic health issues or critical health issues, they have euthyroid sickness syndrome, meaning that their thyroid gland makes less thyroid hormone, even though they're critically ill. So TSH could have still appear normal, but T4 and T3 production is down. Reverse T3 can tend to go up. So that's what this person was critically ill. So while initially the thought process, oh, let's replace the gland. Well, we want to start there once we get all this kind of over medication down to what would have got maybe where the gland would normally make. And then we still have to back off of that because we need to understand this is a chronically or critically ill person. But the benefit then is we're not over medicating them. And as the person starts to get healthy, what we'll see is now we'll see a drive TSH start to crank right back up again because, hey, now the person's no longer in critical illness. And now their body's saying, okay, now we're ready for more thyroid hormone, and their TSH goes up. And therefore we know, okay, now we can start to put more thyroid hormone back into the system because the body's ready to accept it. That may have been a little long-winded, but did that make sense?
It did make sense. And that's, you touched on a lot of important things with what you said. And with the last thing that you said about for testing TSH and it goes up, I'm a fan of looking at definitely a full panel to get a better idea of what's going on inside of the body. I will say that this question in particular really like hits home for me because one, I don't have a thyroid. Two, I do have Hashimoto's disease. And I didn't feel right for quite some time. And so they didn't remove my gland because of the Hashimoto's. I found the Hashimoto's in the midst of all of this. I mentioned this on the one of the other episodes because they thought I had lymphoma, which is also not a treatment to remove the thyroid because of cancer. That's definitely not the go-to move, but there was other circumstances. So my situation was different, I think, than somebody else who has Hashimoto's and then maybe they think the answer is to remove the gland. I will say I've worked with several individuals in my practice that this is the strategy that one of their practitioners believed in, and they had their thyroid removed as a cure for Hashimoto's disease, which I definitely do not agree with at all. And figuring out why there is an immune system dysregulation, I believe, is one of the most important parts to healing the body and therefore having the thyroid and function better. And somebody, well, if somebody doesn't have a thyroid, have the hormones that they're taking influence the body in a more in a better way so that they feel better overall. But if we don't get to what's driving it, like what's driving the immune response, and everybody is different, right? I hear this a lot where a lot of people ask me, like almost on a daily basis, what's the one thing I should take? What's the one thing I should do? And I don't have an answer. And sometimes I feel like it's disappointing for the person asking me that question because, and I get it, we all want answers, especially if we're not feeling well, but there is no one answer because we're all different. What drove my immune response is likely different than what's driving the person who wrote in with this question or anyone else with Hashimoto's disease or any issue, especially immune driven issue. So getting to the root cause of that and then working on improving cellular processes so that we don't have the cell danger response happening is crucial. Otherwise, whatever we do, like you said, we can keep shoving more hormones in the system. You know, I've done that. I've with myself and with other people because we just don't feel well, but it's usually not a lasting benefit, at least not from what I've seen or experienced, that to get a lasting benefit, we have to understand what's going on and work on that. And usually it's not the sexy things. It's like sleep, over exercising, or not moving at all. There's a lot of individuals who are very sedentary. And it's an issue. It's a huge issue.
I think the challenge is, and this is why we need to have more open conversations between practitioners, is that some people just believe it's a thyroid issue. But But if we just simply look at the literature that is out there, we know that once you develop one autoimmune disorder, if you don't start to understand what triggered that immune disorder, you have a higher probability of developing more autoimmune disorders in the coming years. And we see that, and we know there's like Hashimoto's and celiac and type and diabetes are often go together. You see, and I just had somebody who has type 1 diabetes and just sent me their blood work, and then now they have Hashimoto's. And this is, we probably had a conversation, I've just had multiple conversations with this person that, hey, I understand you just want to manage your condition, but at some point, because you're not that interested in addressing the root issue, there's a good chance you're going to develop a thyroid condition, or another autoimmune condition. And they're like, but I'm like, why do you think your physician runs a TSH test when they're checking your blood labs with your diabetes and monitoring those things? They're running that TSH to see when you develop it. They know you're going to develop it. They just think it's inevitable. And I'm telling you that it's not inevitable, but it's highly likely if you don't address it. And then they just sent me their labs, and guess what they have? They now have Hashimoto's. I'm like, okay, now you can make a decision. You can manage your thyroid condition and your diabetes condition the way you currently are, and you can with medication, or if you want, you could start to address what's driving the immune system to be dysregulated. If you decide just to do the medication, that's fine. It doesn't bother me, but you will likely develop another autoimmune condition in the coming 5 to 10 years. It's just what we seem to find. So I feel for the person. Hopefully that answers their question, is that, if you really want to get a handle on what's going on, and if you think you're missing something, the thing you're missing is, and maybe even more important, what your clinicians or the doctors you're working with may not realize, is that you didn't truly have a thyroid disease. You had an immune disorder that created damage to your thyroid. And that is what needs to be addressed. So let's go to the next one.
I do want to just add one more thing, because something you said, it was like it really sparked something in me. Because if the thyroid is removed, like mine, I don't have a thyroid, so that cures the Hashimoto's, right? If we say that that's the end of the road, and we don't address the immune issue, you said this, but there's a much bigger concern, and than just I'm tired, or my levels my levels are not optimal, right? And it's for me, it is paramount to figure those things out. And when I uncovered those with my own life, with myself, other markers of autoimmunity, because I didn't just have that, I had multiple others. And I had specialists tell me I'm hopeless, right? That we're just waiting to get till it's full blown, and then immunosuppression for the rest of my life. So yeah, now things are markedly better because I have improved my immune system dysregulation. So yeah, for the individual who wrote that question, that we're never hopeless, ever. And we need to remember the immune system is actually designed to protect us. And if there's a dysregulation, it can be regulated, is what I'm trying to say.
Or at least we should try to.
Yes. Okay, next question. How does hormone replacement therapy impact thyroid function? And what are the functional medicine views on hormone optimization for thyroid health?
Good. That was a lot. So let's break it down. Give me the first part again.
How does hormone replacement therapy impact thyroid function?
Are you talking about, do you think the person's talking about thyroid hormone replacement therapy or bioidentical hormone replacement therapy? What do you think they're referring to there?
That's a good question. That's good. I was getting from this, when I hear HRT, I'm thinking sex hormones.
Okay.
Of course, hormones mean thyroid also, but that's kind of what I got from it, but I'm not sure.
So how could sex hormone replacement therapy, bioidentical estrogen, testosterone, progesterone, how could that impact thyroid physiology, right? So there's a lot of ways it can impact it. This is we do whole podcasts just on this one question. So you should know that let's take estrogen as a starting point, because that's usually it's probably a woman who's asking. She's probably been told we need to optimize your estrogen and progesterone and maybe your testosterone levels. But let's start with estrogen. If you add estrogen hormone, I guess the first thing that would initially pop into my mind is, why do you need bioidentical hormone replacement therapy, right? If you don't feel well, or you're not making or producing thyroid sex hormones appropriately, you already have an immune inflammatory, some dysfunction going on. It's a good chance that your body is already in a cell stress, cell danger response, and it maybe has the ability to make sex hormones, but sex hormones aren't a priority due to that cell stress response. And so depending on somebody's age, they may be using if they're older, they may be primarily getting a lot of their hormones driven from their adrenal gland. And so in that situation, the cellular intelligence needs to make a decision, maybe what's the most important thing here to spend resources on. Do I need to make more catecholamines? Do I need to make more cortisol? Or do I need to make more androgens so that I can convert those into estrogens? Probably the person's under cell stress response, I would imagine. If you take excess estrogen, I think it's foolish sometimes to think that it's going to work the way we would expect it to work in homeostasis, just because this is my beef with people who say, well, we got to optimize all the hormones first. Optimize them to what? To a healthy person? Yes. Okay, but this isn't a healthy person. This isn't a person in homeostasis. The reason they don't have the hormones regulated appropriately is because they're not in homeostasis to begin with. So just loading more hormone into the system may change some symptoms, but it doesn't restore normal hormone physiology from allostatically regulated to homeostatic regulated. It's like saying the car doesn't run well, so I'm just going to keep the tank full all the time and assume that that's going to make it run better. Well, not if the carburetor's bad, not if the air filter's bad, not if something else is bad. More gas and keeping a full tank doesn't work. I mean, yes, will the car still run? Sure. Is it going to restore the problem that's causing the car to not run well to begin with? No. So I think that part would be part one for me thinking wise. Step two, or the next thing to think about, is if I add more estrogen to this person, what is the potential impact of that going to be? The potential impact of that on thyroid physiology is it may have an impact on the body's ability and the thyroid gland's ability to make thyroid hormone. So there could be a reduction in thyroid hormone as a result of taking the excess estrogen. Number two, more estrogen into that system may also result in lower free hormones from the thyroid perspective, because as you add more estrogen to the picture, you're going to increase sex hormone binding globulin. As you increase sex hormone binding globulins, that affects the other binding globulins. So it's going to affect cortisol binding globulin. So that can have an effect on free cortisol. It can have an effect on your free thyroid hormone. So there may be less free T4 available and also less free T3 and total T3 available, because if I reduce the amount of free T4, then I have less T4 to convert to T3. So total T3 and free T3 can go down. The other thing that can start to happen in people is they add increased estrogen, and especially if they don't have the ability to process it appropriately, or they reduce thyroid physiology as a result of excess estrogen, is that excess estrogen and decreased available thyroid hormone can result in constricture of the sphincter of Oddi, which is the gallbladder and the pancreas come together and dump their enzymes and bile into this central area called an ampullae, and then the valve opens up when we eat to release bile acids and pancreatic enzymes into the digestive tract to kill bacteria and kill organisms, and then help break down and digest our food and absorb nutrients and a whole bunch of other important things. If I'm taking excess estrogen, that lowers my available thyroid hormone, that triggers essentially a cell stress or adds to a reduced conversion. Now I'm going to have multiple challenges. One of those may be I can't open up that sphincter of Oddi appropriately. I get biliary congestion. I have reduced digestion. That's going to create a cascade of problems. It also may mean I have less bile entering the GI tract, which then allows for bacterial overgrowth, which then also reduces the quality and quantity of bile. And so therefore I have less bile acids recycling back into the system. And because I have less bile acids recycling back into the system, and some of them, less of them spilling into the bloodstream, I further reduce the conversion of T4 to T3 because bile acids help signal T4 to T3 conversion by activating deiodinase 2. So those are just some of the reasons why it could be problematic, right? And typically, somebody might be put on testosterone. Could that have an impact? Sure. It can absolutely have an impact on thyroid physiology. And this sometimes can be the opposite effect, where if I load more androgens into the system, then depending on what's going on with estrogen, I may have lower amounts of sex hormone binding globulin occurring. And that can result in more free hormone, more free cortisol, more free thyroid hormone, which can create a drop in TSH, an inappropriate drop in TSH, which then can have a drop in thyroid physiology or thyroid gland production, and potentially trigger more hyperthyroidish type symptoms, upregulation of the sympathetic nervous system. So I don't want to bore everybody with this stuff, but absolutely just throwing hormones, sex hormones, or hormone replacement hormones into the system that say, well, if you don't feel good, I'm going to optimize you to the levels of a 25-year-old. Sure, you may feel better. And for a whole bunch of people, maybe they have appropriate physiology to deal with that excess hormone, and it's a non-issue, maybe. But I see a lot of people that are put on these things I don't think people are doing it maliciously. I think they're just trying, they don't know what that impact is going to be, or they're doing it just to try and change somebody's symptoms, and they don't realize that there could be wide-ranging implications as a result of putting excess hormone into the system. And I think that it's naive of us as clinicians, and maybe patients as well, just to think that if something's low and I just give more, everything should work. I just think it's kind of crazy talk sometimes. Anyway, I'll let you comment because that got long-winded.
Well, I loved the whole conversation with it. I'll say that definitely as a clinician, my conventional training was to look at the labs, and anything that has an H or an L, so high or low, you do something to bring it into range. Mm-hmm. So now my training with functional medicine is much more expanded than that, to figure out, one, is it appropriate, mm-hmm. right? Is it in particular age appropriate? So somebody comes to me, they're on, let's say, bioidentical hormones because their practitioner saw that they had low estrogen, low testosterone, and low progesterone. Is it appropriate for the phase of life that they're in? What are their symptoms? What's their history? What's going on with the rest of their body? I want to know much more than just that. And anytime anyone talks to me about sex hormones, about the thyroid, I always talk about, adrenals, thyroid, sex hormones. Like, I don't separate out hormones or neurotransmitters in the body, things that are going to impact what happens when the hormone is released. Is it going to bind to the receptor site? And as a clinician, I'm very passionate about really understanding a person's ability to biotransform. Not to get too nerdy, but I'm a really big nerd, especially with this. How is that individual able to break down the hormones and get them out, right? So that they're not getting recirculated. And, or what else is bound to their receptors? So the blood levels might look, let's say they might be higher or they might be low. They could, whatever, but something else could be bound to those receptors. And then if we're flooding them with estrogen, what pathway is estrogen going down? Like, these are things, as a clinician, I really prefer to know. My background prior to functional medicine, women's health, is oncology. What pathway is somebody sending estrogen down? And even supplements, right? We flood everybody with supplements. Here's your bucket of supplements. They're supplements for your ill, right? What is the person, how are they able to manage and handle that supplement? What's their liver doing? Like you brought up bile. What's their GI system doing? If they're swallowing a pill, are they able to absorb it? What is their body doing at a cellular level? And I'm thinking about their entire body instead of separating out their body systems. Or, like, I've heard a lot of people say, well, my level was low, so that's why. If my level is low, I need it. Maybe. And like you, if somebody feels great, because I'm definitely not against hormones at all. I'm not against medications. I prescribe medications all the time in my practice. I care more about the whole person, what's all of their symptoms are, and making sure that they have the awareness and the education to be an advocate for themselves for what the potential risks associated with whatever it is that's going on or that we might implement, but looking at a bigger picture and not being so narrowly focused that it's just about estrogen. I've had lots of I'm very opinionated, and I'll argue with anyone if they'd like, but just because something is low does not necessarily mean we need to give it. It might be low for another reason, right? And that if we work on the body, bringing it to homeostasis, if we're working on balancing the body, maybe any symptoms that they had with the low estrogen would go away. And again, is it age appropriate, and looking at the whole picture. So yeah, for this, it's a great question. And this is actually something I hear a lot. Like, a lot of people ask me this question, but taking estrogen can absolutely impact the thyroid and potentially put pressure on the body, increase the stress, the load on the body. So we need to be mindful of that. But like you said, I don't think anybody is doing this maliciously. We all want, I believe we all want, for the clients or patients that come to see us, to feel their best, right? It's just a matter of what's really driving the symptoms so that we can help nudge them in the direction of actually feeling better.
Yeah, I agree. I think we're good. I think we got that one.
Okay. Can changes in altitude or climate have a significant impact on thyroid function and overall health, especially for those with persistent symptoms despite normal labs?
Could changes in altitude or what?
Climate.
Could changes in altitude or climate? So could changes in altitude impact somebody's physiology? Was it directly related to thyroid, or they're just asking, say that again so I can
Yeah,
get
it's
it.
a very interesting question. Can changes in altitude or climate have a significant impact on thyroid function and overall health?
Okay, so I'm going to say when we think about altitude, sure, but these should be temporary. In general, they should be temporary changes, I would say, because the body adapts to altitude. We know this over time, that if somebody moves to an altitude, they may not feel good for a short period of time, but then their body adapts. They make more red blood cells, so they can carry more oxygen, do things. But I would say from a short-term perspective, absolutely, because if you change altitude, it affects your oxygen carrying capacity, and it's going to affect the oxygenation of your tissue. And then that should result in a reduced T4 to T3 conversion, because my overall metabolism is going to need to be downregulated because I have less available oxygen getting to the tissue. So therefore, I can't drive Krebs cycle and electron transport chain at the same capacity. That's also going to potentially result, short term at least, in reduced ability to burn body fat efficiently, because fats need a high oxygen state. Now, in time, the body is going to adapt to that, right? And so we should start to see some change. However, if they're at altitude for an extended and extreme altitude, like let's say they're doing Everest, they may not be able to compensate for that as well, and they may have a significant reduction in T4 to T3 conversion as a result of that hypoxia. So that's a more significant thing. How about, I think it said, the other one was altitude and the other was temperature. Was it temperature or
climate?
Climate. So I would say climate. Yes, we know that when we look at labs, at least based on what the literature seems to show, is that the season of the year, summer, in the summertime, we tend to have lower TSH values than we do in the winter and in the colder season. So if you're living in a climate where it's warmer, you may have a reduced TSH production because you don't need to drive as much energy through the mitochondria, because you don't need to have we call the electron leak to help generate excess heat. So if you're and then in the winter time, when we need to generate more excess heat, you might see higher TSH. That's not because the body's broken or the person's hypothyroid. It's because we need more thyroid hormone to support driving energy through the electron transport chain, because then that allows, if we're pushing it harder, then we can have more electron leak. The electron leak then allows for that energy to be converted, instead of cellular energy, ATP, it can be dissipated as heat. And that's one of the things that helps us keep warm. So sure, both of those things can influence thyroid physiology, which is one of the reasons why, especially when you are getting your thyroid panel done and we hear somebody saying, hey, I want to keep your TSH between 1.0 and 2.0, because that's the optimal range that somebody made up, that may not be good for you, right? And so your body's natural adaptive state in January in the Northeast is to increase your TSH to drive more thyroid hormone to help support more the generation of more warmth. And your TSH goes from 1 to 2.9, and somebody says, oh, well, now we need to give you more thyroid hormone. They may actually create more of a problem. They may actually make you more hypothyroid. They may make you more cold on a regular basis, because instead of the thyroid gland being able to self-regulate, now we've taken that away from the gland, because we've over medicated the person. And we've talked about this on the other episodes of the Q&A, that when you overload consistently too much T4 in the bloodstream, that causes a ubiquination of deiodinase 2, which is the T4 to T3 converting enzyme. So in an effort to optimize that person's TSH into this 1 to 2 region or under 1, we may actually create more of a thyroid problem for that patient and more thyroid symptoms. I think that answers the question. Does
Yeah,
it?
and I think so also. And the key takeaway for me is adaptability, right? And
Mhm.
the thyroid, if somebody has a thyroid, is a wonderful organ in the body, right? If the TSH is elevated, it's elevated to stimulate the thyroid to produce more hormones. So we have to look at what is driving it to be elevated or lower. I absolutely feel climate and altitude can have an impact, but like you said, we adapt. So if we're not adapting, then we need to think even bigger, like what could be interfering with that. Simply giving a hormone, I don't necessarily think that that's the answer to get the labs to the quote unquote optimal range. Now, I was trained on optimal ranges, as were you, I'm sure,
Mhm.
and I understand the thought process behind it. If all we're doing is measuring TSH
Mhm.
and we're ignoring what the actual thyroid is doing, right? Because that's the brain. So
Right.
if that's the only thing we're looking at, we're missing the mark for sure, because we don't
Yeah.
really know what's going on. And we need to think about, because the question had asked, despite, I think it said, despite normal labs, if could it be impacting overall health? If
Sure. But
somebody's climbing Mount Everest, it's possible it could have an influence, right? But you're not
so
living out on Mount Everest, I can't imagine.
right. So I get this all the time where people say my labs are normal, but I have chronic hypothyroid symptoms. Okay, so wait a minute. What labs did you have run? What are you considering normal? Okay, well, there's no H and there's no L. Well, that doesn't mean your labs are normal. It means they are within a certain range, but we've talked about this multiple times. Just because a lab value is in the normal reference range doesn't mean there's not something wrong. You can have inflammation that suppresses TSH and hides a thyroid gland problem. You can have, um, you can think everything's normal with the liver, but you're maybe missing, you didn't run a GGT, which is probably one of the better markers of liver tissue wall damage. So, hey, everything's normal. Well, you didn't run much. You ran a sodium, a potassium, a fasting glucose. Like, what was run, and were they read for H or L, or were they interpreted based on your signs and symptoms? And those are different things. So if you don't feel well and you don't function well, and somebody says your labs are normal, then you didn't get the appropriate tests run, or two, somebody didn't interpret them well. Okay, obviously there's a three. Like you're just making it all up, but most people that are having challenges aren't doing that, right? But those are the options, right? Either what needed to be tested wasn't tested, or somebody didn't interpret the labs appropriately. That's really what it comes down to. And it's
Yeah.
understandable, right? I just I just went through a new patient consultation. They were like, I have had so many labs run, you wouldn't believe it. And it's, they didn't have a lot of labs run. They had a Chem 12 run 10 times. It's the same test run multiple times. To that person, it seems like a lot. That's 12 different tests, right? That's a lot. But it's the same stuff run over and over again. There's a whole bunch of stuff that was never looked at. And so, yeah, I understand it from that person's perspective. But unfortunately, even though they think they got a lot run, they got the same tests run a lot, but what needed to be done and what needed to be interpreted just wasn't done.
Yeah, and what I care about the most is the individual in front of me, their
Hmm.
symptoms, their history, their story, what
Hmm.
they've experienced, what they've tried in the past. And is it just a lab that's, let's say if it was out of range, but they have no symptoms, I want to see the whole picture. And I have a lot of people come to me and they're like, I had a Dutch test, I had a GI, I had this, I had that, and everything's normal. I'm like, well, I would still like to see them, right? Because it is subjective. When I'm reading results, I'm not just blindly looking at it, and everybody that has these results, it means the same thing, because it doesn't. It has to do with that individual and how they feel. And I'm looking at the results through that lens and cross-referencing things and figuring out, okay, could this symptom, let's say fatigue, have to do with this, like the obvious? Do they have, are they anemic? Do they have low iron? I'll run an iron panel. My clinical conventional training, you get to do a fatigue panel. You're looking for on that, you're looking for Lyme, you're looking for anemia. And if those are fine, there's nothing wrong with you. And then the individual hears, it's all in my head. I have a very like low thresholds for that, because that doesn't make anybody feel better. I care more about how they feel, their symptoms, than what the lab says. I'm always going to prioritize how they feel. So if they feel like something is off and everything looks normal, then it's time to find somebody to dig deeper, or to even think outside the box, which is actually, that's why I like that question, because it is something to think about, because people react differently. It'd be like somebody that is used to living near the equator, right? So they're used to more warmth and more light, and they move to Alaska. It might take them a really long time to get used to that. And maybe not everybody, that's going to have the best impact on certain individuals. So it's an interesting question.
Yeah. Let's hit the next one.
Okay. Could my body be reacting to the fillers or dyes in my thyroid medication, causing me to still feel unwell despite taking my prescription regularly?
Could they? Yes. Is that probably the only problem? I would say probably not. I think it is what a lot of times we fall to when we're trying to just consider that, okay, I got to find which one of these medications is going to make me feel better. What's the magic dose? And when it doesn't work, then people start saying the fillers. Now, I've had patients who seem to be reactive to some of the fillers in certain meds. And when we had the medication switch, they did better. But I haven't seen anyone that I can think of where that was the only thing that was going on. And we have nowadays we have Tirosint it's supposed to have no excipients in it. And it's just supposed to be thyroid hormone, and people still don't do well. So it's usually, not that easy. But could they? The simple answer is sure. You can be reactive to almost anything. And the amount of, and some people who have gluten reactivity or gluten sensitivity are told, hey, you can't be on Synthroid or levothyroxine because of the gluten in it. I don't know if that's the case. The amount of potential gluten in the medications is so small. I don't know that that's really a case. And I haven't really truly seen the case made. And I've seen people who have gluten reactivity that still are on Synthroid and levothyroxine because that's what only thing that their doctor would recommend. And they still did well with dealing with everything else. But I've also had patients that just didn't tolerate those things. They did better with Tirosint. But I think the answer is it can be yes, but there's probably more to the picture going on. That'd be my answer.
Yeah, and I agree. I told you I'm opinionated. I definitely don't want, if I'm gluten-free, which I am, I don't want gluten in a pill. If I want gluten, I'm going to eat bread, right? If I'm going to get it. Because I had a lot of people say that to me, like how much could possibly be in there. That's a personal choice for me more than anything else. Okay. Do I think that that could be impacting somebody not feeling well? Absolutely. But it doesn't just stop there. It goes back to somebody reaching for that one thing. What is the one thing? If I had a dollar for everybody that asked me, what is the one thing that's wrong, that's driving what's going on? What's the one thing? I have no idea if it's just one thing. I doubt it, right? Our bodies are so amazing and complex that if it was just a die and we're reacting like that, how would we live? Right? So
Yeah.
I think it can it can definitely be an impact, but so could anything. So supplements. I've had individuals tell me they're allergic to magnesium. Like, well, you're not allergic to magnesium.
Right.
We're allergic to something that's in it, or you're reacting to something that's in that. It doesn't mean magnesium itself, like you can never have magnesium. That, yeah, if we're taking something in a capsule form, a tablet form, then there is going to be other things in there. So
let me jump in on that, because that happens a lot. Like, if somebody says, listen, I'm allergic to magnesium, you have to say, okay, first of all, you're not. It's in everything. Two, maybe we're giving you too much magnesium, maybe. Or number three, I don't know where I'm at here, but it's magnesium is typically attached to something when we give it to somebody. So then we would have to say is, okay, what form of magnesium seems to give you the problem? Is it magnesium hydroxide, oxide? Is it magnesium citrate? Is it glycinate? Is it malate? Is it threonate? Is it, like, what is the form that bugs you? Because it might be not the magnesium, but the thing that it's attached to that has an impact. And this is where we have to go when we say, when we think about, oh, I'm going to give you magnesium because I wanted to do X, right? It's only going to help the positive pathways that are going to make you feel better. And the reality is, magnesium is used by 600 different enzymes in the body. That's argued. Some people say it's 800, some people say it's 200, but who cares? But magnesium is used by a lot of enzymes as a cofactor. Just because we give you magnesium doesn't mean all that magnesium is just going to be used to make you feel good. Magnesium may go to support pathways that help some inflammatory mechanisms to help with the cell defense. Magnesium may go to do things that maybe aren't going to increase ATP production or aren't going to help you with a specific detoxification pathway. So it's nice to think like we can direct the magnesium to do what we want it to do. But oftentimes when we give people supplements or people take supplements, we have good intentions. We want them to do what we want them to do as if they are in homeostasis. But if they're not in homeostasis, which is most of our chronically ill patients aren't, that nutrient that we give them may be used to support the allostatic or adaptive cell defense response, which may actually make them feel not so good because it is trying to do the thing. It's trying to use the thing that's most important to the cells and tissues, which is ramp up an immune inflammatory response, which often doesn't make us feel well initially. So that is not unusual that people say those types of things, but it is one of those things that we probably have to keep reinforcing. Like, you don't get to direct this anymore, any more than you can direct a toddler to do exactly what you want them to do, right? I mean, they're going to be like, well, okay, whatever. They're not even knowing what they're doing. They're just going. And sometimes the magnesium is put into the body, and then the cells and tissues are going to use it or not use it based on what's happening at those cells and tissues.
Yeah, again, we're highly complex, right? Mm-hmm. And I always, if somebody tells me, oh, I've tried that, it doesn't work, or I've, whatever, I want to know the brand. What are they taking? How long have they been taking it? Where they got it from? right? Is it a reputable place that they had it from? Because these things absolutely matter. Because I've heard about magnesium, but honestly, anything. If somebody says that they have a reaction to something, even food, right? Has nothing to do with this question, but I think it's important to like tie it together where maybe more people can grasp this concept. Like somebody telling me they're allergic to everything, right? Everything they eat. Is it really everything that somebody is eating? Is it even the food? Maybe. Is it just their body, their immune system, their gut being more permeable, that their immune system is reacting to things? There's so many other things to consider than just, I took this capsule and I got nauseous or whatever. I had some kind of a bad side effect. I want to know more. I want to understand more about the situation. But yeah, it definitely could be something like that. Personally, I try to stay away from dyes and fillers as much as possible, within reason. I'll say that within reason, because if we become overly stressed because of now I can't take any of this thyroid medicine and I'm going to have it compounded and then my insurance isn't going to pay for it, and their stress goes through the roof, what impact is that going to have on their body?
Yeah, it just incites further the cell stress response. So that's what we have to be really careful about. But all right, let's hit another one. Okay. We run out of time here.
Yes, it goes by so fast. Is there a link between histamine intolerance or mast cell activation syndrome and thyroid symptoms?
So is there a correlation? There absolutely can be. Yeah, I feel like I've answered this question a bunch of times. Hopefully we didn't do this before, but it's worth saying again. So mast cells get the blame for all histamine issues. Almost every cell can release histamine. Okay. So that's important to know. So just because you have a histamine response doesn't mean that you don't have mast cell activation syndrome. So that's number one. Number two, mast cells can store thyroid hormone in their granules. We don't think they can make thyroid hormone, but they can store thyroid hormone in their granules. So when there is a release of histamine, there's also a release of thyroid hormone. Now, is that good or bad? Well, I think I talk about this in the book as well, and that this may be an adaptive response. Under a cell stress response, there's cellular or tissue decreased conversion of T4 to T3. But we don't want this all or none principle. So it's not like it's on or it's off. It's just a reduction. But we still need a certain amount of thyroid hormone to kind of help those tissues function appropriately. And so it's my thought process that many times when there is a hypothyroid type situation going on, it may be that if there's a cell stress response going on and there's local tissue deactivation of T4 to T3, mast cells and other immune cells come to that area, and it might actually be a really an adaptive response to help support those local tissues with some thyroid hormone as part of the release of histamine. So that's part one. Part two is if you do have hypothyroidism, you can have excessive histamine. Okay. So that's one, because you're going to also have a hard time metabolizing the histamine, because what most people, I don't know if most people know or don't know that there's different ways to break down the histamine. In the GI tract, we've got mechanisms to break down the histamine. But once we have histamine inside the body, then we have a separate method of breaking down the histamine, which utilizes something called methylation. And to methylate things, you actually have to have sufficient levels of thyroid hormone to make or to support the MTHFR gene that helps convert folic acid to methylated folate to support methylation. So in a hypothyroid state, you can have more histamine in circulation. One of the reasons because you can't metabolize it as well, and you still maybe have things triggering some histamine release. But when you over prescribe thyroid hormone, excessive thyroid hormone can increase histamine responses in the brain, and that can create a lot of excessive histamine response. And especially maybe one of the reasons why people who have too much thyroid hormone have a lot of brain fog and brain fatigue and neurologic symptoms because of the excessive histamine that's hitting their nervous system. So you can have histamine issues with both hypo and hyperthyroid conditions. And it doesn't mean you have to have Graves or hyperthyroidism, but with over medication, it is not unusual to see people have hyperthyroid or histamine-based symptoms. And I think for those people, a lot of it isn't just peripheral, like itchy skin and some of the other things we consider with histamine. I think it really probably ties to a lot of the brain-based brain fog, inability to think. I think it really affects those types of symptoms in somebody. So I like my clients to know, like, hey, well, as we're working on this, you might have, if we start to see some of these specific symptoms start to worsen, it's a good indication that we probably need to reduce the medication again. And I've had a number of clients that have reached out to me and say, hey, I think I need to reduce the medication again because my brain fog has come back and my weight's plateaued, or I can't, now I have anxiety, or now I'm having more sleep and insomnia issues and fatigue issues. And then they have their dose reduced again and they're like, all better. So matter of fact, I think I talked to a patient last week or two within the last 2 weeks, who I think when we met, she was taking maybe 150, maybe 200 milligrams of T4 per day. And she's no longer on any thyroid medication. And every time, like when she had all those symptoms, and every time the dose went down, the symptoms would stabilize. We'd be working on stuff, and then she'd be like, "Oh, I'm getting the symptoms again," and we'd wind up reducing the dose, and then they'd improve. And so it was a steady decline over the course of less than a year to get from that big of a dose to no medication and still have their labs look back to normal. So yeah, definitely can.
I love this question because I feel like it's a very thoughtful question. And again, it comes down to looking at the whole picture. And like you said, this is very important, right? It doesn't just mean I have itchy skin or I have a rash or something like that. Something could be going on at a much deeper level. And that's why I am adamant about somebody keeping a journal. If I put them on something, whatever, the supplement, even dramatic change to food, I want to know how are they feeling, and for everything, not just am I nauseous, right, or am I itchy, but how are you able to think clearly, like what's the overall picture, right? And to not be afraid of our bodies. I feel like I see a lot of people who have significant health stress, like especially those with autoimmunity. And I can absolutely relate because I was in a pretty dark place myself for a significant amount of time, thinking my body was broken and out to get me, and that it was just hopeless for me, that we are constantly seeking homeostasis. Our bodies are designed to adapt for our survival. So if something is going on and we're having an upregulated histamine response and we're having all of these symptoms, or maybe we're not having symptoms that we understand, then I want to know more about the overall picture and what are we doing to let the body know that we're okay. Like I feel like sometimes I probably sound crazy with some of the things I say, but again, I don't care because there's a reason behind it. But like, even just like I tell people when I'm coaching them through this, Like even just saying I'm okay, everything's like, am I okay? Okay, I am. I'm not, I didn't burst into flames. I'm still here. Everything's okay. My labs might not be okay, or I might have this symptom or that, but I'm okay. My body can heal. I absolutely believe that with every fiber of my being. And the most important thing is that we have to believe it, right? So if we're only seeking out lab values or a dosage or even a symptom, and we're not here, right? Here is not in alignment. Here is not in alignment. Where whatever we do, I always ask everybody I work with, what do you believe? Do you believe that the path we're going down is going to take you where you want to go? Because there's no such thing, people will disagree maybe, but there's no such thing as like magic, right? Like I don't have a magic wand, I wave it, and that person, it has no symptoms and they're perfect because I put them on X amount of whatever, right? What do they believe? And what are they willing to do? What are they willing to do for that? It's not just about a medication, a supplement, or whatever. Even I'm going to go gluten-free or dairy-free and that's going to cure my Hashimoto's. Maybe, right? But what is somebody willing to do? Like you talked about in your book, and we've talked about numerous times. What is the whole picture of that individual? I want to know more than just they believe they have mast cell activation syndrome and we need to jump on a protocol for that. What's the whole story? Because how is their body going to be able to process, break down, utilize whatever it is we bring in or remove?
Yeah, I agree. I think that's I think it's all well said. So let's move on to the next one.
Okay. I've heard about the concept of thyroid resistance, similar to insulin resistance. Could this be why I feel symptoms of hypothyroidism despite normal lab results? What can I do about it?
They've heard about thyroid resistance and okay, so I think this goes to what we've talked about the whole time, right? Cells and tissues get to determine what happens with thyroid hormone, versus we get to dictate it by just overloading the system. So is it thyroid resistance? Is it like, I'm not sure what's the right term, but I think it's really what we're talking about. Cells can resist thyroid hormone coming into cell because they don't want to increase their metabolism. They can deactivate it right at the cell surface. I think in most cases, when there's cellular resistance or a cell stress response going on, we're going to see that oftentimes from a reverse T3 perspective. We may see more of that deactivated. The problem is we're not going to see that as much from a T3 perspective because we're not measuring the T2 levels. And so we may not see, hey, what form of T2 is showing up in the bloodstream, because we're not measuring those things. We're not measuring the other ways that thyroid hormone can be broken down or metabolized. We're only looking at really, oftentimes we're only looking at T4, which we're not looking at any of the metabolites. And sometimes we're looking at 3, and sometimes we're looking at reverse T3, but there's other ways it can be broken down. But I would say, I think that's what's going on, but I don't like the term because I think it means like the body is like it's doing something wrong. So,
Yeah.
you know what I mean? It just
Yeah,
it doesn't sit well with me, but
yeah.
the answer is simply yes. Yeah, cells and tissues can resist thyroid hormone. Now, a lot of times what we'll hear is that if you have high cortisol because of high stress, the cortisol is blocking T3 from entering the cells. I don't know how much it is that I don't know if just because of high cortisol blocking the entry into the cell, or the cells are just deactivating thyroid hormone, or they're not bringing it in, or there's because of the cells, high cortisol is a secondary response to high stress, and high stress then activates the inflammatory mechanisms in the cell danger response. And I guess the other thing is it's not uniform across the body, because why would I say that? Because to have cortisol means you have the ability to convert T4 to T3 inside the cells and tissues, because you need T3 for the adrenal gland to make cortisol. So it's not like, oh, I just have high cortisol, but everywhere else I've got hypothyroidism. It's not that simple. That's the only way it is. Every tissue can self-regulate, so that's important to know. So yes, you could have high cortisol and hypothyroidism somewhere else, but it is, I think it's kind of too simplistic of a thinking, like, oh, it's like it's an all or none principle. But I think the easiest way to answer the question is yes, cells can resist T4 and potentially T3 coming into a cell, or reduce the amount of T4 or T3 coming into the cell. It's rarely ever an all or none principle. But there can be a reduced amount of active T3 inside the cell binding to receptors as a result of what's happening at the cell and tissue level, and maybe potentially more significantly influenced by other factors. But those other factors that we're typically talking about creating the blockade are typically associated with more of a stress response. So who's to say?
Yeah, and I think word choices are so important, and I don't like necessarily the word resistance here either, right? Implying that there's something wrong. And this individual asked, and what can we do about it? Because that puts a tremendous amount of pressure on us, right? Like on our understanding, our thoughts. It can raise the stress response, raise cortisol, which could have a further impact downstream with every other things in the body. So much as if we think that there is something going on, like if we have a functioning thyroid, but we feel hypothyroid symptoms, versus if we have diagnosed hypothyroidism and we're on thyroid medication, but something still feels off. We need to, again, the common denominator is we need to really dig deeper and figure out what else could be driving it, but at the same time, giving ourselves like some grace and some grace. I can't think of a better word, where we can, again, like going back to me telling people to just like everything is okay, because we're designed to seek stability, right? That even I or anyone else that doesn't have a thyroid, my body is still seeking to utilize the exogenous hormones that I'm taking to have everything work together and for it to work the way that it's supposed to, right? So if I have concern that something else is going on, sometimes I feel like one of the best things a person can do is to start thinking about joy in their life, because we can become so hyper fixated. And again, I'm very guilty of this many times in my life, that we could become so hyper fixated on our health because we don't feel well, that in and of itself could be a huge trigger for us to feel worse. And depending upon the driving factor for thyroid dysregulation, if there's an underlying immune issue, right? Our joy that we can get in life, the way that we feel, our beliefs, our mindset can have a profound impact on our health, either positively or negatively. So sometimes I feel like, not that we shouldn't stick our heads in the sand, that's not what I mean. And I care about any symptom that somebody has or their concerns that they have. But sometimes bringing in, like, what are you doing to down regulate your stress? Right? How are you sleeping? Right? That if we add one more, I call it monkeys on the back, right? Like, I have this, I have that, or a label, like what else is wrong? What else is wrong with me? right? I add one more thing on top of that person, and they already believe there's something really wrong with them, all of these things wrong. What's that next thing, that next burden that I put on them going to do to them, right? That I would rather, like, there's always hope. Like that's a very important part for me, because I had that kind of stripped away for me on my journey. It was I was told that that was what was going on, but I also self-imposed that for a long time. And it wasn't until I did the most basic things, the most basic, not the fancy this or that or every supplement in the world or whatever. It was the most basic things that true like change started happening for me. Right. And those are the things I didn't want to do because I didn't think that they mattered. So I'm on a mission to spread the word that those are the things I believe that matter the most.
Yeah. Yeah. Well said. I think we'll leave it at that. Let's go to the next one.
Okay. Can physical exercise impact thyroid function? And what type of exercise is beneficial for somebody with thyroid issues?
Sure. Thyroid exercise can influence thyroid function. It can support improved conversion. You can also have reduced conversion as a result of exercise. So your thyroid hormone is going to change based on physical activity and exercise. You're going to get an increased conversion, and you're going to have a period of decreased conversion so that you can allow for recovery. So that being said, if you're getting labs done, you probably shouldn't do any exhaustive exercise like right before, or intense exercise right before you're going to get your labs done. I usually tell people, hey, probably want to, especially if you're struggling with chronic thyroid issues, you probably want to, not do it, maybe not do anything overly intense the day before. You don't want to necessarily exercise the morning before your labs because it could throw it off, just naturally throw it off and then kind of hide what's really going on. But we've talked about this multiple times. Thyroid hormones adapt. So we have to consider that we should see changes depending on, like, when did you exercise? What kind of exercise was it? Now, what's the best exercise for someone who has hypothyroidism? To me, it doesn't necessarily change whether you have hypothyroidism or you don't have hypothyroidism. You should do, on a regular basis, you should do some strength training. You should do some slow aerobic, what we call aerobic training or cardiovascular training. Like if you want to do like a walking or jogging, but within a aerobic range so that you're not creating more stress on your physiology. I think you should do some short-term, high-intensity exercise, which doesn't mean I'm going to do my 60-minute HIIT class. That would not classify for me, but it would be short, intense bouts of sprinting. But that's short and intense. Maybe you're in and done under 20 minutes for some short, intense bouts. And maybe you're doing a short sprint, allowing for recovery, short sprint, allowing for recovery. And whether that's sprinting on a bike, sprinting on an elliptical, just sprinting. You should be doing some level of stability work on a regular basis, yoga, Pilates, flexibility, mobility training, whatever you want, whatever it is, but you should be working on mobility, strength, and your cardiovascular health on a consistent basis from a exercise perspective. How much should you do? What type should it be? For how long should it be? That really depends on a couple factors. Your individual tolerance. If you're a person who can't tolerate 30 minutes of exercise because you have poor recovery, because you're still trying to figure out what's going on with your cell signaling, then I think you should do short bouts. I call it 20-minute fitness or 30-minute fitness. Set your timer so that when you sit at your desk, every 30 minutes, your timer's going off and you get up and you do 5 squats or 5 push-ups or, 5 step dips or something, 5 lunges. I don't care what it is, but you do 5 or 10 exercise movements. It takes you about 15 or 20 seconds and then you go back to work or you go back to doing what you're doing. And that way you're not doing long-term exhaustive exercises. But if you did that, you might find by the end of the day, you were able to do 50 squats, or if today's push-up day, you might have done 100 push-ups where you would never be able to do that in a 20-minute session. You can do it, but you do it to tolerance. If you have HRV, you do some exercise, you look at your HRV. If your HRV is recovered, so you're at the same level or higher than you were the day previous, then hey, you're good to go. You could probably go a little bit harder today. You can probably do a little bit more today. If your HRV is lower than it was, then you probably need to do a lower activity, lower intensity day. So, hey, I did some lifting yesterday, but my HRV is a little bit low. Great. Then don't do that same maybe strength training and just go for a nice slow walk. But especially for slow cardio, I like people to try and maintain a optimal aerobic rate. And I typically use Phil Maffetone's basic calculation, which is about 180 to 170 minus your age. Now he minuses things for drugs and conditions, but I think for the vast majority of people, if they stay within that 170 to 180 minus your age as your kind of the level for where you should be at with your slow cardio, you're probably not going to tax yourself and make yourself have greater issues, even if you are still struggling with underconversion of your thyroid physiology. But I think sometimes we use our conditions as an excuse to not be physically active. There are just too many benefits to being physically active and doing some strength training. Now, you don't have to go out and buy weights. You don't have to join a gym. You can just do very simplistic body weight type movements and exercise. You can just walk, you can just stretch, you can do mobility. I don't even care if you just say, listen, I'm going to try and make 10,000 steps per day. Fantastic, right? But you have to maintain a certain level of mobility and physical activity, because it improves muscle physiology, which is going to help pay off dividends in the long run. It helps with sleep and quality of sleep. It helps with mood and mindset. It helps with gut biome. There's just so many positives to exercising. What I would recommend against is exhaustive, intensive activities. I have hypothyroidism and I'm struggling, but I want to be a triathlete. How about we don't do that, because all you're going to do is make yourself worse? And how about we get you healthy and then you train up to becoming a triathlete? I want to run it. I'm struggling with thyroid issues, but I want to run my first marathon. Well, I think that's great, but you probably want to maybe bite off with something smaller, and you probably want to work your way up to that, making sure that you can train in that 170 to 180 aerobic range when you're doing your training. If you can't stay within that range, then you're probably not going to be ready for that distance. If you're the person who says, hey, I want to be a CrossFit athlete, or I am a CrossFit athlete and I CrossFit is my life, but you're struggling with thyroid issues, you probably need to give the CrossFit a break for a while and ease back and let your body get a chance to recover. I have a couple elite level CrossFit athletes that I work with who have struggled with thyroid issues. And they do a lot of things right? They do a lot of things right. I don't think for some of the people that I've worked with that their nutrition is off. I don't think their exercise is really the problem. They usually have other issues that create the cell stress response, and then their drive to be an elite athlete, they can't turn it down. So now their intensity of activity and exercise, on top of being physiologically reactive to something, mold or something else that's impacting them, that compounds the problem. But it all depends. I think for everybody, especially when they're struggling with thyroid issues, the vain thing is, I'm overweight, so I need to exercise this stuff away, and then they crash. A, you probably don't need to do that. B, if you're overweight, like really overweight, you've got a chemistry issue So do the things you can do, the low hanging fruit, make sure you're eating healthy, eating well, moving, exercising, sleeping. But the vast majority of people who are overtraining many times are overtraining in an effort to lose body fat, assuming that the fat is the reason they have a health problem, when in reality they had the health problem that causes them to store fat, and overtraining in that situation isn't going to fix it.
There are so many clinical pearls in everything that you just said. Like, several really resonated with me. And when you said you like during the day, set a timer and do some squats, I kid you not, this is my office, right? That I'm in right now. And on a daily basis, I'm literally getting up and demonstrating. Like, you don't need anything, just your body. And I'm just as guilty as this a lot of times with being sedentary. I'm very active a lot of the time, but when the days that I'm in my office, it's hard for me to tear away, right? So I talk a lot about the concept of high producers. So individuals that are hyper focused on things, and they got to get things done, and they're excel at their jobs, right? But then they're sitting, and I'm like, let me see your watch, and we compare, and it motivates me because other days I'll get, not that you said you're not really looking at steps, but I'll get like 25,000 steps, and some days I'm at 1,500, and it's 8 o'clock at night. I'm like, well, okay, Tara, it's a wake up call for me that I need to do the same things that I'm talking about all the time. And they're easy and these things are free, but they're not easy, right? Because it takes an understanding of why you're doing it. So I love that you brought that up, because even when I worked in an office, I would do like wall push-ups, and I'm all dressed up in my work attire over there. And I'm like, you could do this. And they were like shocked. So many people were shocked. They're like, what are you doing? Or if I'm sitting there with them and I go and I stand up and I'm like, I want you to do like this, and I'm showing them, and I'm like, you could do that from your desk. Because if I hear all the time, I don't have any time. I don't even have 5 minutes. If you don't have 5 minutes, we got a bigger problem. Because if you don't have
Yeah.
what am I going to do to help? I'm not going to be able to do anything to help, because there's a mindset right there that your health is not important. Right? Everything else is more important. And I tell people, talking to them, you're the most important person in your life. And if you don't value yourself, what am I going to do? Nothing. So I love that you brought that up, because it's so easy, and it's a note to self. I need to do more of that myself, right? And I do challenges with patients of mine also, and we text each other our steps, because I'm like walking around my house. My husband's like, "What are you doing?" I'm like, "I didn't get enough steps today." I need to move, just like I'm telling everybody else to move, right? So you said that, and I love that you talked about training to heart rate variability. That's an area really underappreciated. And for me, I have multiple devices. I am a data junkie, to say the least. But the one device that my Oura Ring, not a plug, I've got no affiliation, but this doesn't hype me up. Like, my watch has me, move more, go run more, got to do more, where this slows me down, not to the point that I'm sedentary. That's not what I mean. But I would train. I used to run twice a day, every day. I was that person, not in CrossFit, but triathlons every weekend, racing. I was doing really well, burning myself out. I was worked full time, in school full time, like doing way too much. And I literally took a nosedive. I ended up losing my thyroid and getting all of these diseases. Could that have contributed? Absolutely. Is that the one and only thing? I don't believe that, but I do believe it definitely contributed. And now I look at what's like the readiness score with whatever device, and looking at my heart rate variability. How did I sleep? How do I feel? Right? I've got numerous individuals, they started working with me, and they're telling me, I'm looking, because I have them track sometimes do different things, and they slept 5 hours, and then they're eating, like under eating, massively under eating, maybe 1,000 calories or less. And I see they did a 55-minute workout. I'm like, we need to talk about this. We need to talk about, like, And the thing of it is there's that light bulb moment. It's hard at first because especially if somebody's looking to lose weight. I used to weigh 75 pounds more than I do now. And I had doctors tell me to eat less and move more without asking me what I was doing. And I was over exercising and under eating at the time. And so, that light bulb goes off or goes on, however you use that term. I usually say it wrong. And then they start making these little tweaks and they can't believe the change that can happen with them, with not just from a weight perspective, but just the way they feel, right? Like we don't even think about how we feel anymore. It's like we just got to go, and it doesn't matter how we feel. So there's both sides, right? Somebody's too sedentary and somebody's over exercising. What's the perfect exercise for your thyroid? It depends. What are you doing right now? And how's it working for you? And how do you feel? Right.
Yeah.
And then training to you and your unique. I do a lot of genetic testing and I'm a fan of thinking about our genetics too. Like I'm a slow recovery individual, but I never listened to it. And now I do, not as an excuse to not move, but as a empowering me that I don't have to run myself into the ground, right? Because if I'm looking to be my best, feel my best, everything matters.
Yeah. Yeah. Yeah, I wish there was it's the same question that somebody might say, what's the best diet for somebody with hypothyroidism? What's the best exercise? It's really individual. It's based on your goals. It's based on where you're at currently. But the foundational principles would be still the same. Increase a wide diversity of ways we train ourselves, just like we should have a wide variety of foods that we eat that are whole food based. And listen to the physical cues of when we need a break or when we need to train. And then always, I think the other thing would be making sure we've got some type of reminder when we have a busy world and we don't have a great physical fitness habit. Because it's easy to get, like you said, it's easy to get to the end of the day and realize you haven't done much. A lot of people just don't like to exercise and work out. So the drudgery of trying to slog themselves through 30 minutes of workout or a physical training or a class or something is just not going to happen. And they don't care enough to develop their own workout routine or workout program. So in those situations, having some type of cue to remind you, I need to be doing something physical regularly through the day. And almost everybody carries one of these things around. You can easily set the timer to just go off through the day every 30 minutes. And then you just do something that you can do with your own body, like jumping jacks, squats, lunges, something. Just pick a new activity different activity every day. And or if you want to make it more complicated, pick multiple things. Like every time it goes off, I'm going to do something different. But from a simplicity standpoint, I typically tell people just pick one each day of the week. Monday's push-up day, Tuesday's squat day, Wednesdays, I do dips on my stairs or on my chair, like just pick something. And worst case scenario, if you're sitting and in between doing this interview, this session, I've been up, I've been down from my stand-up desk on my wobble board, change position, right? If you say like, I am so busy, just get up and move for 30 seconds is going to be better than staying statically sitting, because it's easy to get stuck in a position and realize, oh my gosh, it's 4 hours later, I haven't really done any movement. So I think that's key to keep in mind. And it's a great place to finish, because now we're at the end of another one and we got to move on to other things. So Tara, thanks for coming back on and doing another Q&A. My guess is we're going to meet again, and you'll reschedule for another time, and we'll try and get a few through more of these for the listeners. what I've decided to do is put these out. Typically, I release a podcast like every 2 weeks. And so what I'm going to be doing at least for the next I'm guessing 4 or 5 months or so, I'll have the 2 regular episodes come out. And then I'll probably have the Q&A episodes as a third bonus episode. So we're not jamming them all together. So we'll probably release one of these Q&A episodes every month as a bonus until we run out of questions. Okay. Awesome. So Tara, thanks for coming on the podcast and sharing your great questions from your followers. And I look forward to the next episode, probably in the next, it'll release next month from wherever this one's released. And, but I'm sure you and I will talk probably sooner than that. Yes. All right.
Sounds great.
All right. Take care, everybody.